The question is the amendment be agreed to, and I call the member for Bullwinkle.
Bullwinkle. Thank you, Speaker. And I rise to speak on the National Health Amendment, Cheaper Medicines Bill 2025 also. Speaker, on July 22nd, I walked into Parliament House for the official opening of the 48th Parliament, and it was a very proud moment to be the 10th nurse and the 4th midwife in Parliament and the very first federal member for Bullwinkle. It's a seat named after Nurse Lieutenant Colonel Vivian Bullwinkle, World War II hero and the sole survivor of the terrible 1942 Banker Island massacre. A few days later, I experienced yet another proud moment, voting yes to make medicines cheaper. From the 1st of January next year, no Australian will pay more than $25 for a prescription on PBS. Now, let's think about that for the moment. The last time the medicines were this affordable was more than 20 years ago, in 2004. And that's just not numbers on the page. It's a real, tangible cost of living measure that will make a difference in people's lives. We've already delivered the largest cut to the cost of medicines in the history of the PBS in 2023, and now we're going even further. For the average household, this is a 20% cut in the maximum cost of PBS medicines, saving Australians more than $200 million a year. Now, I know from my own life just how important this is. I became a nurse when I was just 18 years old, following in my mother's footsteps. Being a nurse, you very quickly learn that access to affordable medicine can mean the difference between someone getting better or somebody ending up in hospital. I've seen what happens when people skip doses because the cost is too high. And remember, for many people requiring medicine, especially for chronic diseases, they're often on more than one medication at the same time, many medications in some cases. So that's why cheaper medicines aren't just good for the hip pocket, they're good for health. When I'm out door knocking and speaking with people in my community in the Bullwinkle electorate, this is one of the issues that comes up again and again. People have told me that they're grateful when medicines become affordable and that this will make a big difference to their bottom line. And for pensioners and concession card holders, we know that money can be tight, and that's why we've frozen the cost of PBS medicines at $7.70 until the year 2030. No rises, no surprises, just certainty. Speaker, this builds on action we've already taken to ease pressure. In July 2022, we reduced by 25% the number of scripts a concessional patient needs before that PBS safety net kicks in. In January 2023, we cut down the maximum cost of a general script from $42.50 down to $30, the biggest cut in PBS history. And from September last year, we rolled out 60-day prescriptions, saving time and money for people with ongoing health conditions. And from January 2025, for the first time in 25 years, PBS co-payments won't rise with inflation. And importantly, all medicines that pharmacies can discount today will still be able to be discounted when the new $25 co-payment comes into effect. This is a clear and consistent commitment from this government when we said we would make medicines cheaper and health more accessible and affordable, and that's exactly what we're doing. The Prime Minister, Mr Albanese, has said it best: the size of your bank balance shouldn't determine the quality of your health care. And that's what this is all about, making sure every Australian, no matter who they are or what they earn, can afford medicines that they need. I'm proud to stand here as the Bullwinkle representative, but also someone who's worked in healthcare since I was a teenager. I know the difference that this will make to people's lives. The Albanese government is delivering real cost real cost of living relief, and not just words, but as I've indicated, commitment and action. And with this legislation, we're making medicines cheaper than they have been for 2 decades. We're building a fairer, healthy Australia together. This is also in addition to our Medicare urgent care clinics. In the Albanese government first term, one of their commitments was to build 50 urgent care clinics, Medicare urgent care clinics, where people can just walk in without a referral, without a credit card, and get quality, accessible health care. We said we would deliver 50 in that first term, and we over-delivered by providing 87 clinics across Australia. 2 of those clinics service the people of Bullwinkle. There's one in Gosnells and one in North Midland, both on the border of the electorate. And thanks to the Labor government, one of the new commitments, when we'll build another 50 around the country, is to be actually in the Bullwinkle electorate with my commitment to a Medicare urgent care clinic in Kalamunda. Speaker, we are working consistently to provide better health for people, more accessible health and more affordable health. Thank you.
I thank the member for Bullwinkle.